Good morning, everyone, and welcome to this important event of launching the policy brief on women's economic empowerment and unpaid care work in regional policies, with a particular focus on Africa. And just to say thank you all for making the time to attend this launch. And with us today, the people that I'm going to mention include Porter Williams, who will join us later. And then we have Shamim Dasteger. She's the International Program Manager. She's also present with us. And we have some colleagues from the African Union. They will also join us. And quite a lot of civil society representatives, as well as most members from the ActionAid countries. And we also have individual feminists and activists who have interest in this. So we just want to welcome you to this launch of the event. So to kick us off, Jane will sort of like talk us through what we're going to do in this policy brief and how it will be done. But just to share also that the POWER project, some of you have already known it for a while, it's looking at 4 key themes of women's economic empowerment with a specific focus on violence against women, climate resilience, sustainable agriculture, and unpaid care work, and looking also at like changing policies, practices at local level, at regional level, and also at the international level. So I'll ask Jane to come through now and take us through how we're going to go with this policy brief. Thank you.
Hey, hi everyone, this is Jane. Welcome to the launch of the policy brief. I would ideally get everyone together, do a face-to-face launch, but it's not really feasible with distance and cost. So this is our online launch today. I'll just... Ta-da! So the policy brief is now live on the Power Project website. I'll just share with you, I think hopefully I'm sharing the screen now with the Power Project website. So it's now on the site. You can either find the brief through the news and event stories, this one here, or the brief itself is stored in the resources section under the Unpaid Care Work section. I'll just scroll down. And here we go to open that. And I'd just like to thank everyone, as Christina said, who's been involved in getting the brief together. It's been a real collaborative approach. And so thanks to everyone. We'll be talking about the contents of the brief and discussing it a little bit more later today. But I would, of course, encourage people to have a look through the brief in your own time after this meeting, and also to share it with others. Tweet the link, which ActionAid International will be tweeting, I will be tweeting, and others will be tweeting. So we really want to get the discussion going on these thematic issues. It's already started, and we just want to input to the discussion and the debate, and ultimately contribute to a change in the enabling environment for the rural women that really are the key part of this brief. So yeah, also to note that we have, this one is very much focused on Africa. We have another similar brief that will focus on South Asia coming out quite soon. So look out for that. And I would also encourage everyone to sign up to the Keeping in Touch button on the Power Project website, which is on every page, this area here, sign up. If you just sign up there with your email address, we can keep you in touch with new reports and new events such as this webinar. So I will just now hand you back. Oh, I'll just show you. Okay, so it's now, as I just said, online, and you can access the brief, and I would encourage people to share it as well, and to follow the Twitter handles below on the site, who will also all be promoting the project brief. So yeah, thank you, and I'll hand back to Christina now.
Thanks, Jane, for launching the brief. So the brief is officially launched now, and everybody can have access to it. And just to get a sense of what this policy brief is about, and we will have some time to sort of like look at questions and also share experiences. But Shamim Esteger will take us through what actually is in the brief. And it looks really at what the women in agriculture in Africa are doing, and the issue of economic empowerment, and how unpaid care work is undermining rural women's economic empowerment and rights. And as a burden, unpaid care work restricts the amount of time that women have to spend on other activities. So we'll hear a little bit more about that, and how the issue of large-scale farming is also impacting on unpaid care work as well as climate change. And we'll hear a little bit from case studies from Ghana, from Rwanda as well. And we will also hear a little bit on other experiences from the different colleagues. So I'll ask now for Shamim to take us through what is contained in the policy brief. Thank you.
Thank you. As you know, this is the first of the series of this policy brief, which is purely focusing on Africa. And this is mainly to bring out the linkages also between the women's economic empowerment and how the unpaid care work is restrained in making them economically empowered. And first, I would like you to take through how women are struggling for their time, and especially how their time is going in spending for the unpaid care work. And as you know, unpaid care work is more for the caring, and it doesn't get recognized. So in Ghana, the rural women spend at least 6 hours per day on the unpaid care work. That is 10 times more than their male counterpart. That is amazing. And in Rwanda, women spend at least 5 hours on the unpaid care work compared to the 1.5 hours by men. You can imagine how much time is spent extra. And in sub-Saharan Africa, an estimated of the 40 billion hours a year is spent collecting water. That is, they almost spend a year of labor, which is of the entire workforce of South Africa. And in Africa, it is the lack of quality and accessible health services resulted in 70 to 90% of care to people living with HIV and AIDS being provided by women in recent years. And women were at the forefront during the Ebola crisis. So they were taking the brunt. Can we go to the next slide, please? So we can see what are the ways in which the unpaid care work, which is keeping the rural women, continuing in the property, and it continues to contribute to violate their human rights. The first is the economic empowerment, because they cannot have this because the less time available for the farming and other income generating activities, and they cannot learn any new skills, and therefore they cannot apply, because they have to spend so much of time, as we saw before, in taking care of the ailing people and taking care of the children, and that is one of the main reasons. And in terms of food security, they have very limited time to learn the climate resilience and sustainable agriculture to farm. For example, a woman has to walk long time to even fetch a pot of water. So when she comes back, she just has enough time to get ready the other things. She has to do all the household chores without absolutely no help from the other household members. And it's also women's education. Both the women's education, mental and health rights are affected due to heavy workload, and they don't have any time to study or rest, because the women's day typically starts, as all of you know, it starts at around 4 a.m. in some places, and normally at around 5 a.m. until the time they go back to sleep, which is around 12 in the night. And they also have absolutely no political voice, because through the unpaid care work, that they lose their recognition, they lose their representation, and they cannot redistribute their work, and they cannot reduce their work. So it affects majorly for their participation in the political arena also, in terms of the local, national, regional, and international decision-making forum. And forget about even international, they cannot even take up the leadership roles in their local governance. And women's unpaid care work burden increases their vulnerability to poverty, so which increases their vulnerability to violence and discrimination. And it also affects their economic equality. So how do we connect the dots on violence against women, unpaid care work, and women's economic empowerment? So one of the study done by ActionAid found that women who experience severe intimate partner violence earned up to 43% less income than the women who have never been abused by a partner. And in another internal study which was done, it was found that women's economic empowerment can reduce violence by reducing their need to negotiate with male partners. It is in Tanzania. And the Power Project also observed that redistributing the care work between men and women can reduce violence between them. And this is as per the evidence from Rwanda. And in another point, Power Projects has observed the more the violence is. So because they also reduce the time spent on income generating activity, as we saw before. And women's economic empowerment is not a silver bullet to end the violence against women and girls, but it has been evaluated as one of the best in terms of reducing the women's experience of the violence. So they can have their own decision-making powers, and they can have a say, and it increases their bargaining power. And this policy brief, it gave the main recommendations for a regional policy. The first is the Agenda 2063 takes notes of recognition, valuing, reduction, and redistribution of women's unpaid care work. And it works as an indicative strategy towards delivering on its priority area of decent work, income and jobs. Nevertheless, the commitment is not made into the first year implementation plan of 2063. Therefore, we recommend that it need to be included. And in the African Gender Scorecard, a monitoring tool for implementation of the Agenda 2063 for now has no indicators to measure the amount of time women spend on unpaid and domestic work. This, we believe, is the key structural challenge to be addressed if African rural women are to enjoy their economic empowerment and rights. And the next one is the national governments. The finance for the investment in the public services that address the unpaid care work and the climate resilient sustainable agriculture and women's economic empowerment has to increase. And the support for the women's movements and the organizations in their advancement of the women's economic empowerment must be done. And the recommendations for the private sector, it says that to undertake the due diligence on the impact of the company activities on unpaid care work and women's human rights in accordance to the UN guiding principles on business and national laws. And they also need to pay a fair share of tax to enable resourcing for reducing unpaid care work on women through the public investments in the public services. And the accountability mechanisms underpinning the CADP, it lacks the gender-specific targets and indicators, including those related to the women's access to financing and investments, supporting services or infrastructures that reduces their unpaid care work. This, I think, we need to really lobby with CADP to achieve our results so that the women attain their economic independence. That is it. Thank you.
Thanks, Jamim, for that very interesting presentation. We will have some time for questions and clarifications and maybe lessons from others. But right now, I'd like to ask Claire from ActionAid Rwanda to share a little bit about their experiences on working with policy on unpaid care work and women's economic empowerment. Please go ahead, Claire, because I think this was also helpful to see how the regional is also connected to the national and what successes or challenges we've been having in terms of policy work at the national level. Thank you. Go ahead, Claire.
All right. With the experience that we have had at the national level is that we, after collecting the evidence on unpaid care work, we shared through time diaries and baseline survey. This was shared with the Rwanda Ministry of Gender and Family Promotion in order to revise their family policy in 2013. And after that, there has been more of review process, including community sensitization, and then direct community engagement with the ministries, national leaders and parliamentarians in order to advocate for recognition, improved redistribution of women's burden on unpaid care work. And as a result of ongoing advocacy, there has been a success on child care centers, whereby today there's a policy on child care center, and the ministry came up with an idea of implementing a similar kind of approach called home-based child care centers. And these home-based child care centers is that women can be able to have these children be in child care centers and have more time to do productive work. And this was really done through a lot of engagements, having national dialogues, and still there's more that we are still doing, because what the challenge has only been on kind of, when you look at, there are really like, there's still a challenge on social norms, and then cultural mindset, where you find that people themselves still look at unpaid care workers a role for the women. And what is needed is kind of doing more sensitization and raising awareness to the community and to all people to understand that really this is not about the role of only women, it's a role for both men and women in order to have more of time for women to have really to be empowered economically. So what has been more of a success is where the government is able to understand and was able to see that women spend more time on unpaid care work. And when they came up with a policy on ECDs, there has really been progress and success where women are able to even now have more time to do more of their agriculture, to do more the agriculture that would lead them to have income to be able to take their products to market, whereby most of the time you'd find they would not be able to have time to do that, because the children they always needed to have more time to care for their children, and therefore this has really contributed a lot. More childcare centers that are coming up, and today the Ministry of Gender and Family Promotion requests that each cell should have a home-based care center for children to be able to be taken care of, as mothers are able to go for other productive work and being able to even do work that is going to contribute economically. So far that has really been a success.
Okay, thanks a lot, Claire, for that, for sharing that. I think there's a question for you on whether the government of Rwanda is actually funding the ECDs or how that is working. Perhaps you can take that at the end once we open up the forum. Yeah.
All right.
Great. Thanks a lot. I would like now to ask Azumi Mesuna to share a bit about the experiences in Ghana Azumi, can you hear me? It looks like we are not able to hear Azumi, but we'll ask her to come in later. Okay, then maybe I'll go to Sam right now to just make a few comments and remarks on this launch. Sam Fox is the Senior Programs Manager for Multi-Country Projects, and she's based in the ActionAid UK and oversees the Power Project. So Sam, if you could say a few remarks, we'll ask Azumi to come in a bit later. Yeah.
Excellent. Okay, great. Thank you. I just wanted to say a huge thank you to everyone who's worked on this brief. As Jane mentioned, it really was a collaborative effort, and we're really proud to launch this first of the Power Project's policy and research series. I, of course, want to say a particular thanks to our donor, the Dutch Ministry of Foreign Affairs, who've helped make this happen through the Funding Leadership and Opportunities for Women Fund, of which the Power Project is a part. So we're really excited to have this first brief, and this really represents part of our undertaking to better understand and also to share an understanding of how these key issues are impacted on and by each other, and then also how that plays out in a policy environment. So this is a really great opportunity for us, and this launch particularly as a platform for us to have some open discussion, to be able to do some sharing and learning of experience around these issues, and also really an opportunity to bring together organisations and individuals who are also working on the same issues or similar issues with the same objectives as those within the Power Project. So I think the information and the recommendations that are being generated by this work are incredibly useful. And I do think that if we can work together around some of these key areas, we'll really be able to see an important change in the lives of women that we're working for. So really just to say a big thank you to everyone. Hopefully we'll be able to hear a little more from Azumi on the Ghana experience. But we're also really keen to hear from the other attendees as well. If you have questions and comments, but also your own experiences to share, please do feel free. Thank you.
Thanks, Sam, for sharing that. Okay, so probably now I can open the forum to questions, clarifications, and comments. And maybe to start it off, Claire, you could probably share a little bit about the role of the government in the ECDs.
And really is wants like people to be able to maintain these child care centers, but the government provides land, provides even rooms, for example, in cells where there are schools. They've been able to provide rooms where these children can be able to be. And when they do that, they really request, like, they don't pay the care centers, but you find among parents around, there are those who come up to be able to they really encourage that they should think about, they can look at the care centers, they can be able to contribute in paying for the care centers. But the government itself has not yet started paying for the care centers. So it is also kind of something that is still in the process, that people are they haven't yet got like at a level where these care centers can be paid. But in some communities, parents are able to pay the caretakers. So it is kind of still a challenge when it comes to sustainability and kind of maintaining these child care centers.
So please feel free to ask questions on the main policy brief, as well as what has been shared in terms of Rwanda. I mean, the questions that we're really trying to explore is on the issue of how unpaid care work is undermining rural women's economic empowerment and rights. And also the issue of land deals and women's economic empowerment, and how that links to unpaid care work. And what kind of new models can we think about that could really be useful for the women in Africa in terms of economic empowerment and climate resilient sustainable agriculture. And why is it important to connect the dots, the intersections, that we don't look only at one area, but at how each of the areas is related to each other, like how unpaid care work is related to agriculture and how it's connected to violence against women, and hence that addressed collectively in policies. I can see some questions from Chimwemwe Gondwe. If you'd like to go ahead and ask your question.
Yeah, Chimwemwe Gondwe, ActionAid Malawi. Yes, I wanted to find out from Claire, because in Malawi we are still grappling with these ECDs, but we look at them as an opportunity in terms of how we can redistribute work between men and women. So I wanted to find out from Rwanda whether they have been able to motivate men to become caregivers. And also we are also having issues in terms of keeping caregivers on board. How are they motivating these caregivers? Secondly, I wanted to find out the aspect of redistribution when the policy brief was being launched, because observation has shown that the redistribution at household level, it is the older women supporting the younger women with the household costs. I don't know whether we have in ActionAid experiences where we have men taking on board some of the household costs that women were doing earlier. Thank you.
Okay, thanks for that, Chimwemwe. Beatrice, I don't know if you'd like to ask a question to explain a bit about what you have sent us. And so Beatrice, can you hear me?
Mine is just an addition on what Gondo has already said.
Please go ahead.
Yeah, I just wanted to add on the role that government is doing in Rwanda on the ECDs. As Mama already said, in Malawi, we are also trying to lobby the government to support the ECD centers, but all the people that are working there are volunteers. So we just want to know what steps is Rwanda taking so that maybe we can learn from you guys on how best we can do this, as we are also looking for the government to do more. Thank you.
Okay, thanks for that. I don't, if there are there any other questions? There's Beatrice and then there's Maria Salvador. Please, you can go ahead, Beatrice Mugambe and then Maria Salvador next.
Can you hear me?
Yes, I can hear you now.
Okay, I had a follow-up question to Claire when she mentioned that the government provided land for the ECDs, and that they still have a challenge where managing the ECDs and paying the people taking care of the ECDs is not yet catered for by the government. And my question was if they are in the process of also getting involved in the budget process, because the budget towards those ECDs has to be found within the government resources. Otherwise, it won't just come up that government funds those ECDs in terms of maintaining them and ensuring that they are managed well. Because if we don't do that, then it means that women in the communities will continue to go and provide that kind of unpaid care work. And the recognition will just be, you know, they're taking care of what they are supposed to be doing. So what is it that the Rwanda team can do, or even other teams that are working on the project can do to ensure that actual government funds and maintains those early child centers? When we were in New York this March, I think we were in a meeting where colleagues from other places of the world were mentioning that governments are actually funding the maintenance of the centers, which relieves the women of the burden to look for the resources to care for the centers, but also avails them the time to do and engage in economic empowerment initiatives.
Thanks, Beatrice, for that. Please, if you can say where you're from and just
I'm Beatrice Mugambe, based at ActionAid Zimbabwe office.
Okay, great. Thanks a lot. But I understand Buba and Roslyn. Buba, can you hear me?
And thanks for organizing this webinar because it's helpful in clarifying a lot of issues. The dimension I had wanted to bring along is the work that we're doing at the African Union level and how that relates to unpaid care work. Because increasingly, I think the policymakers and officials at that level are beginning to recognize that unpaid care work and women economic empowerment is the way to go. And, you know, over the years, what we've been doing is basically working on the agriculture, Department of Rural Economy and Agriculture, trying to bring in women smallholder farmers issues to the table and how they have been disenfranchised because of their lack of access, control, and ownership over resources, all leading to the burden of care that also, you know, transcend to their livelihoods. But moving on, we were able to also engage the women gender directorates, you know, at the AU that has a sole responsibility of working on women's rights issues and gender issues. And currently, there are consultations for them to work on the development of the gender policy. That is the review of the gender policy, and then the, you know, development of a gender strategy. And interestingly enough, there is a whole consultative group that is looking at unpaid care work. What are some of the issues we are trying to look for? So it means this gives us the courage to say that at least our noise, you know, our messages have been heard across all the you know, should be finalized. It should be able to trickle down to the national level, the regional levels first, and at the national level. So I believe that's where the bulk of the work should be, and that's where we need to concentrate our efforts. You know, countries like Rwanda are doing their utmost, but still, I think there's room for improvements. You know, and the message needs to be out there so that everybody is aware of it, and then governments are able to do something. I think we have moved beyond the denials. You know, now there's recognition that women on paid care work need to be recognized, it needs to be redistributed, and it needs to also be recognized by the policymakers. So, you know, that's what we've been doing. And I believe after that consultation, when the strategy is finalized, we want people at the different levels to engage, you know, in the consultative processes. If you want to partake in that, you can be able to link with myself or Christina. We should be able to find a way of bringing you on board to the consultative process. So for now, Christina, that's what I have to say. Just to thank you and team for doing a great job, you know, and encouraging you to continue what you are doing currently. Thank you.
Okay, so we'll go ahead and ask Roslyn to come in and make a comment.
Okay, thank you so much, Christina. And thanks to you and ActionAid for organizing this important webinar, and congratulations for launching the brief. I have quite a number of questions, but I'm going to just pose one for now. And really my question is centered around you know, the policy briefs that you've made, which are very clear, and also very clear in terms of who you are targeting. So for instance, you know, you mentioned that you are also just targeting the finance, the national government, so that they finance investments in public services in order to address unpaid care work. And I suppose a lot of that is around how we can reduce, unpaid care work among primarily women and girls, and especially looking at agriculture. So my question there is just, do you have any experiences, or have you looked at also issues around time and labor saving equipments, especially when you're looking at women and agriculture? Because while we know that, long term, we want our governments to look at addressing issues of public services, but there are still, things that can be done at community level, at national levels, to reduce the drudgery of unpaid care work. And I'm speaking from also the experience we've had as Oxfam, when we piloted some time and labor saving equipment, so things like fuel efficient stoves, and also trying to bring in water tanks, closer to households to reduce the distances of walking for women in fetching water. Do you have any experiences around that? And is that something that also should be, pushed for? And that could also maybe be how we can also partner with private sector around that.
Thanks, Rosaline. Maria, then Lona, please just introduce yourself, where you're from, and then maybe you can make your comment or question. And then Azumi is now online, so we'll ask her to go through her presentation after the 2 questions. And Claire, just to let you know, probably you can check some of the questions that have been raised as well. Thank you.
Thank you. This is Maria from Alianza por la Solidaridad, Spain. Thank you for this initiative. It's very interesting for me. And I have some questions about how in this project and this initiative, what kind of strategies do you use to involve men in the reproductive areas and the reproductive sphere? Because sometimes the change of the involved women in productive areas is easier, but the involvement of men in the reproductive areas is more complicated. I think that in this question in the local level, but for example, in reference with the policies and the government, I would like to know what kind of initiatives are you generate to make awareness or to advocate to change or to generate equality policies to guarantee the access for women, for example, for the more basic rights. I think that it's very important to link these kind of things, the economic empowerment, with not only with violence against women, that it is very important, but one of the things that we think that it's very important is the sexual and reproductive rights, because it's if women don't have access to health, to her basic rights, it's very complicated to involve or to generate or improve their economic situation. Thank you.
Thanks, Maria, for raising that. Yeah, definitely, these are some of the things that we also consider when we work on unpaid care. But I think my colleagues from Rwanda and Ghana, they also share a bit about some of our experiences. And I guess we can continue with the learning and sharing. I think similarly with Oxfam, we as ActionAid, we have some interventions that we've used apart from the childcare centers. So probably when Azumi is presenting, she can also touch a little bit about some of those, because we might not have enough time to respond to all the questions. but definitely we'll just share a little bit of what we have now, and we can always be connecting after this meeting. So Lorna, please say where you're from, and maybe you can say your name and where you're from, and then others, you can make your comment and or clarification or question. Yeah.
Hi, this is Lorna. I'm from South Africa. I'm working as the Southern Africa Regional Age Network Coordinator, and I'm employed by HelpAge International. The issue of unpaid work, we're seeing that obviously a lot in Southern Africa, and this means that women are unable to save for their future, and particularly older age. I wonder if you looked at that and made any recommendations regarding future savings and pension.
Okay. Thanks a lot for sharing that. I can say that at the moment we haven't looked specifically at the issue of pensions and savings, but we have looked maybe more broadly at the issues of protection, but we would be ready to explore other areas that relate to how that can actually be connected, because of the recognition that the work that has been done by women throughout their lives has to be recognized, and the savings that they have made, but also even just their time has to be coming in terms of the protection measures that social protection provides for some of these services that help to reduce unpaid care work burden on others. So I think, Lorna, I know that Kate is about to say something, but I'll probably ask me to come in. Then maybe we can go back to Kate, and then we ask the panelists to respond to questions.
Yeah. Good morning to everyone.
Morning, Azumi.
Yeah, I think I just want to share some highlights of our unpaid care work, and then our experiences in terms of advocacy, national advocacy specifically, and then the challenges. In Ghana, we've been trying for the past years to promote the campaign on unpaid care work, and we've used a number of interventions, which I know probably childcare centers have been mentioned. But as part of our stakeholder engagement at national level and local level, we've tried to also institute time-saving intervention in terms of energy saving stoves for women farmers, looking at it from two perspectives. One is on climate change aspects, trying to reduce devastation in terms of destroying the environment, and also promoting women economic empowerment. We've also tried water harvesting structures where women are provided with water facilities to harvest water from rain catchment areas and other close by, to support reduce the time they spent on water, as well as using time diary as a major tool for dialogue with stakeholders, both at community level and with local authorities. And I think it has helped to really create a lot of recognition around the campaign on unpaid care work, more especially at the local level. But when it comes to issues of national advocacy, bringing the evidence from across this level, the last question was around social protection. I'll just mention a bit about that in terms of Ghana, what has been done so far in relation to that. In the previous phase, we had the opportunity to involve elderly women in LEAP program, which was supposed to provide social protection for elderly women in terms of supporting their health insurance, in terms of providing them with basic at least 2 square meals on monthly basis to be able to have some leisure time, rest, and access health services. This was part of the unpaid care campaign as part of the social protection measures. But I think in relation to the other areas, we've been able to also successfully work with Ministry of Gender and Sports to enroll child caregivers in terms of coordinating these two ministries to enroll childcare givers to support the existing childcare centers. So as part of our experiences, we think that going forward, we are launching a policy brief and we are taking the recommendation forward as part of our advocacy initiative. It is very good for us to ensure that there is coordination among ministries, especially ministries that have some kind of line functions or relationship. For instance, in Ghana, we have issues of childcare centers, though it's under the Ministry of Gender and Children, but it's a component under Ministry of Education. So that kind of coordination should be there between Ministry of Education and Ministry of Gender to ensure that, and we have to, in a way, support to facilitate these things. And I think what has also helped in terms of national advocacy is for us to work with our allies at various levels, because our campaign on the LEAP wouldn't have been successful if we were not able to work with some of our national partners to support us in that regard. And we have also seen that over the years, taking forward some of the recommendations from our research and other actions, we've seen that we try to align these research activities, the goals of the research, with that of the ministries to ensure that they match with their priorities in the short term and in the medium term to be able to help us build a concrete understanding of how we progress with the issues, as well as building on our personal relationship, our long-term contacts with them, and then making follow-ups to be able to have some kind of success around unpaid care work and the alleged witches program. And then one other thing that we were able to do is to contribute very well to the design of the National Gender Agricultural Strategy in Ghana with the National Department, Agricultural Department of Women. But how did we do this was to play a critical role when it comes to the workshops and other things with them, providing them with information and some technical information from our experiences on the ground in terms of the challenges, how they can mainstream gender issues in agriculture. So with that, we were able to support the preparation of the strategy as well as contribute to reflect the real issues on the ground. So this therefore means that we had a terms of reference that gave us a way of defining our roles in what ActionAid is supposed to do when it comes to the strategy development. We also tried to participate in all the meetings that we were involved in. But looking currently at power, for instance, we are able to meet the ministry and make some kind of impact because we try to resource the advocacy work in terms of, when I say this, so in terms of providing them with technical information that they require. For instance, as part of our work with them, they have asked me to support the chief director to develop a concept note on CSW event for next year. And they are prepared to share whatever they want to do with ActionAid in terms of how they will take up the CSW event for 2018 and what contribution do we want to tailor up or we want the government to take up as part of their presentation. And I think we are getting this positive feedback and responses because of the kind of information we give to them, the comments critical comments we make in some of the things they want to do, as well as keep on involving them in some of the activities that we do. And with this, we are seeing at both levels a paradigm shift, both at local and national level, a paradigm shift in terms of attitude, in terms of policy, because gradually we have been able to influence policy. For instance, next year, we have planned with them to review the Ghana childcare policy, just to ensure that it matches with the current demands of unpaid care work, the campaign we are doing, and other issues or that they need to add to the childcare policy to update it. And we are getting this positive feedback because of the support and the regular update that we are giving them. And in terms of involving them with our work, we involve them in all aspects, as well as bringing them to our programs and other, even sometimes inviting them to the field to see what is on the ground. If the minister cannot go herself, their team team members is able to go once in a while to look at whatever we are doing, and they also learn from that when they meet other NGOs and other donors. But we still have challenges because definitely, even though ActionAid is an INGO in Ghana, but we have other NGOs who have more funding with bigger projects than we do. And sometimes they come in with this kind of bigger projects and funding. And because that proper coordination is not there at the INGO level for us to coordinate ourselves with, they're not really ignoring, but it disrupts the process in a way. And you might begin to start up again in certain things, but we still manage to overcome some of the challenges. The other challenge is that national advocacy is really expensive and involving, because taking forward the recommendation from the policy brief means we need to vote more resources for national advocacy going forward from 2018 to 2019 to really work on some of the recommendations, as well as the recommendations from our local baseline report, which shows that about 75% of national policymakers said, yes, we will need to commit and more resources to unpaid care work, but it needs some kind of budget from that of civil society to be able to take up these issues with them on a regular basis and to push for the changes that we want to see. But from my personal experiences, I'm thinking that there is no guideline for, especially when it comes to national advocacy, there is no straight line to doing it. It depends on how you understand the issues with them, how you understand the priorities of your government, the priorities of your individual ministries, and how you are able to coordinate these issues with them, as well as how you bring them together to understand these issues, understand their role. And in that regard, you will be able to start influencing the policy process, because it's a process. You cannot do everything at a go. But once you are able to understand that you need to get into their priorities, fit into what they want to do within, because they also have action plans, they have timelines. So once you are able to fit into that, you are able to influence what they want to do and their plans. So I think basically in Ghana, using our interventions, we are trying to get them on board, such as the school feeding program. And they are enrolling some of the groups at the local level to the bigger national programs to be able to contribute when it comes to provision of certain foodstuff, cereals for schools at the local level. So I think we should also have that connection between the issues, the interventions on ground, and the national policies that are taking place, so that we are able to feed in from the community level up to the national level. So I think briefly, this is what I want to share from Ghana. If you have any question or feedback, I would pause and then take those questions.
Okay, thanks a lot, Azumi. I think you have shared some of the things that I also wanted to ask you regards the other experiences on unpaid care work and the role of the government. So I'll ask Joanne to make a comment or clarification, and then Roslyn, if you can briefly say what you would like to share about the training. Then we'll go back to Claire and Azumi for maybe some wrap-up kind of comments, which firstly answers the questions, and then your final comments. Thank you.
So this is Roslyn again. Roslyn Nyatanza from Oxfam, project coordinator working on WeCare. And I had just written that, these were just my thoughts around one of the other main recommendations on supporting women's movements in organizations. And I was just saying, with our experience, we also really noted that it was important to really work with women's rights organizations and women's movements, and actually really make sure that we've got allies who can really push the issues forward. We galvanize support from all the different sectors. And in engaging with women's rights organizations, one of the main things we came across was them just not understanding the issue to say, what are we talking about? And so we then organized a very intense 3-day workshop to just train, and we called it a trainer of trainers, because the idea was that they would then also go to their different constituencies in training. So it really cut across all the different themes, from recognition to reduction, redistribution, and even representation of unpaid care work. A very participatory tool. So what we did is we actually adopted and adapted a manual that was developed a couple of years back by ActionAid, actually Oxfam and IDRC. And this was a manual on redistributing unpaid care work. And what we did was to just condense the manual from the suggested 5-day training into a 3-day, and actually begin to change some of the tools, so that they also speak to our current context, and to ensure that we can package it and make sure that the information is comprehensive enough for anyone who's starting to engage with unpaid care work for the first time, or someone who needs to be building their skill. And that training also really includes aspects around building skills in advocacy. So there's even different tools around role play and co-creating messages together with participants. And so we found that one to be, quite a good way of bringing different allies together to begin to talk about these issues. And also because it cuts across the different themes that women's movements work across, whether reproductive health, women's economic empowerment, self-livelihoods, or even violence against women and girls.
Okay, thanks Rosalind for that. So I guess you'll be able to share some of these resources with us, and then we can continue with the conversations. I think it's a space for everyone to be able to share. I think if there are other organizations also interested in those, then we can always be connecting. So Joanne, please go ahead.
Hello. From the Rwanda presentation, my interest was on how is the behavior change amongst the men. I remember one of us had already asked such a question, because both men and the government are stakeholders in the ECD program. Or after are they starting to realize that there's some behavior change, or are there steps being made, or there's, what can I say? Okay, are there steps being made? Is there some behavior change they can notice?
Okay.
Yes.
Okay. Oh, great.
Christine,
So,
can I answer that?
yes, please. And also there are other questions that you can also sort of like explain a little bit.
Yeah.
If the unpaid care work burden is not being shifted to women or to older women, if you can also speak to that. Yeah.
Yes, we have we have seen that there has been change in behavior. There has been change and success, and not really, we are not yet there, but then we've seen men testify where they're able to participate and support their wives in doing unpaid care work. When we hold public dialogues and being live on TV and radio, people are able to exchange and to even ask and to learn more. And we've been really, we've been able to have our rural women farmers come with their husbands. And because of filling time diaries, men have realized that they have really not contributed to their homes enough in looking at the time they spend on unpaid care work. And some of these men that fill the time diaries have really changed, that today they're able to support their wives. And mostly when it comes to women in cooperatives, when a woman goes out to have a meeting and to also do kind of saving in the cooperative, a man is able to understand that she's contributing for the family. And so when he's at home, he does the work. We have seen testimonies and success stories. And even when we go to communities, mostly in the areas where we are carrying out, we are intervening, there has been success. Actually, like yesterday here in Rwanda, people celebrated around the country, all districts, they celebrated the Rural Women's International Day. And in one of our LRIPs, that was, they legalized marriages, mass legalizing marriages. And during legalizing the marriages, that was a campaign on unpaid care work. And men were really told about how legalizing their marriage, they're not only becoming man and wife in a home, but they're going to support each other in everything, and including unpaid care work. These men were ready and they were showing positive kind of answers, and this really shows there's change. And then what we can do, someone asked, what are we planning to do when we talk about how the government, what the government can do in terms of being that we are not yet there. There's always, every district has a gender budget statement. And so what we are going to do, what we are actually doing, as ActionAid and as Power Project, is that we are going to continue advocating so that this gender budget statement that is there to address gender responsive public services, and more so, not only that, looking at women's issues, we are going to continue addressing advocating so that unpaid care work should be given priority and be addressed under this kind of particular budget line. And not only that, the government also promotes biogas, but apart from promoting biogas, they have what we call district annual performance contracts. So in the district annual performance contracts is that they involve many different things. But what we are going to do is to advocate that within the district annual performance contracts, at least they should involve all activities that are able to reduce unpaid care work. And maybe what we can say about seeing men, like saying that the much of work is burden is put on only women and girls, and maybe we are seeing some bit of change, like I told you, and this is done through community sensitizations, when we hold even we do this raising awareness in schools, whereby girls and boys understand what is unpaid care work, what roles do they think, like knowing that these roles are not particularly for girls or for women, but knowing that they can do all roles. And this is done mostly when we go to schools in all our areas. So I really think with more raising awareness, kind of more advocacy in terms of advocating to really understand recognizing what this unpaid care work is and how it contributes to the family, not only and how, if really women were given more time to do more productive work, how it would contribute to the families, not only families, even to the development of the country. I think really more will be done.
Thanks a lot, Claire, for that. I don't know if you have any final words to the team, but this will probably be like your closing remark, or any other remarks you want to make before I ask me. Because of time, I'll now ask for the last round of comments, and if you have anything else, maybe I'll let Azumi speak, and then if you have anything, just let me know that you'd like to add something. And then I'll ask Shamim and Sam if also you have anything to say. Okay.
Yeah,
Okay.
thank you, Christina.
Okay.
I want to comment on the shifting of work burden to girls and probably elderly women who are also supposed to have their quality time as a right. Building on what Claire said, in Ghana, we also use school girls clubs and boys clubs in terms of supporting them to lead sensitization at schools as well as during community sensitization, and also supporting their women groups to be able to present their issues to duty bearers. So this is just to create that awareness that it's a role that benefits the whole community. The externality doesn't go to only the woman, it goes to the entire community. The whole society benefits from that. And once you cut them young, right from the beginning, it's a way of also building sustainability of the campaign, because once you target only elderly women and men, generation phases or the project ends and the message remains with only the elderly people. But once you target the younger people, you are able to feed into other groups in the society. And what we also did that made a lot of impact in terms of feedback is to use activists and young urban women, as well as the women lead farmers and community facilitators, to lead radio discussions where we have them doing their campaigns in local languages at various community and district local stations. And I also think the sensitization for media also helped a lot in terms of when it comes to the elite groups, their understanding about unpaid care work, because sometimes we think that it's an issue among only the community level of some of our sisters and brothers who haven't been to school, but it's also an issue among we, the elites, which some people, we need to educate and sensitize some people. So the sensitization for media really helped, where we have some media personnel testifying and giving testimonies that they actually didn't see it as an issue, which really helped in galvanizing that effort around the media. So when there's anything on unpaid care work, you see that many media houses, they are interested in it. It's something they are interested to share with other people and to blog it, to share with others. But going forward, I'm thinking for me, the policy brief has a number of significant recommendations which will push the implementation of power project as well as contribute to our program development. We need to consider some of the challenges we have in advocacy and how we would work to address them to be able to push the recommendations forward, even if we are able to push some key priorities out of all the recommendations. But at least within the period from now up to where we have power project, we are able to push some few priorities that would create impact when it comes to policy, as well as create that linkage from the policy level up to where the interventions are really felt by the affected group.
Thanks, Azumi, for that. Claire, just back to you in case you have anything else to say before.
I think that the policy briefs, they have all that we really focusing on what we have agreed on as recommendations can be really tackled, I think would really be able to reach there. So.
Okay, thanks a lot, Claire. Kate, do you want to make a comment, a quick one, before I ask Shamim and Sam to come in? Kate from Promundo, you had something to share about your the resources that you have.
Hi, can you hear me?
Yes, I can hear you.
Okay, great. Thanks very much for giving me a few minutes. It's really exciting to hear all of the great work that you all are doing, particularly on the advocacy and at the AU level and everything. I just wanted to highlight a little bit of our work. I work for Promundo, and we're co-coordinators of a global campaign called Men Care, which aims to engage men in unpaid care work and help redistribute care within the home. And we've recently launched the State of the World's Fathers 2017, and this report is all about kind of making the argument for engaging men in unpaid care work and some of the policy priorities. So I think it's a really useful document for those who are interested in engaging more on the issue of men's caregiving. And I also just wanted to say that we're really excited because we're going to be launching soon results from a program that we implemented over 3 years in Rwanda with the Rwanda Men's Resource Center, which was aimed at engaging men in sexual and reproductive health and rights and violence prevention. And unpaid care work was also a critical component of this program, and we were able to conduct a randomized controlled trial over 2 years. And we've seen in the households that participated in this program, which targeted fathers, creating spaces for fathers to come together and share their experiences, but also with their partners. We've seen significant reductions in both sexual and physical intimate partner violence. And we've also seen significant increases in men's time spent on unpaid care work and more shifting and a more equal distribution of these tasks within the home. So we're looking forward to publishing and sharing those results really soon in Rwanda and globally. But one of the interesting things that we see is despite more time spent by men and redistribution a little bit in the home of the sharing of these tasks, we do still see that women are still spending much more time. So we're interested to look further at how can we, how can engaging men in care work really reduce the time that women spend on these activities. So I would just encourage those who might be interested to check out our Men Care website or get in touch to find out more. Thanks very much.
Okay, thanks, Kate, for that. Definitely, I think there are opportunities for collaboration with also our colleagues in Rwanda at some of these important moments. So I'll ask Shamim to say something, like your closing remarks, if you have something to say.
Hello, yeah. Actually, though this is focused on Africa, there are two interesting examples I would like to share in this forum, which has led to some serious policy change. I mean, one of it has led to policy change. In Nepal, similar child care centers were started, and what happened was the women themselves, they contributed on a very, very nominal charges to run the childcare centers and in different parts, and that was given as a model to the government. And then it was later, after lots of struggle, it is not a cakewalk, after lots of struggle, this has been included in the rural policy. The policy was also written by ActionAid. This is the work done by ActionAid, and the rural policy for women is developed, and the child care centers are included in that, and now with the budget allocation. So it is a very, very long road to go, but I also see this as a contribution for the policy influencing, and also as the increased ownership of women, because the women also involve themselves, and then the men, they also start contributing to them, and they bring the children to the child care centers and they leave them there, and then again they take them back, and then they help the children to get ready in a very small steps, but it leads to some change. And another example I would like to tell is creation of the development of the male role models in Southeast Asia, and identify the youth to be the change agents, and they actually speak for the women's rights, and they talk about everything, and they become sort of role models, and it also boosts their ego to involve them and also keep them engaged in the women's rights work. So this also has worked very well. Yeah, and yeah, I see as the beginning, and I think the documented evidences and then linking to the micro to macro will definitely lead us the way. And thank you.
Thanks a lot, Shamim, for sharing those experiences. I think we'll hear even more. I think also I'll take this opportunity to say that we'll be launching also another brief for Southeast Asia. And some of us, I know that we've just had a glimpse of what Shamim is sharing, but there will be more sharing more also during the policy brief launch in Southeast Asia. But we will tell you when we are ready for that launch. And we can keep on learning from each other, because the challenges that women are facing in the Southeast Asia and also in Africa, they are similar in terms of unpaid care work burden and also the challenges of women's economic empowerment. So Sam, if you can come in with some of your last remarks.
Hi, Christina. Yes, thank you very much. And a huge thank you to everyone who's contributed today. I mean, really, I feel like a lot has already been said. So I just want to add that it's really inspiring to hear some of the stories of change, the ones that are coming out of the project already, but also from other projects and organizations that we've heard today. I think also hearing about the different ways that we're all raising awareness of these issues, whether that's in communities, through the media, or with our decision makers and policy makers. So it's really exciting and inspiring to hear all of that. And I think also really amazing to hear about the work, the resources, the other research that's coming out through other parts of ActionAid, through other organizations and other projects. And I really hope we can all stay linked up so that we can really maximize the impact of all of that. We do still have a long way to go on some of these issues, but I think that through sharing experiences and working together to raise issues of women that we're working with, we're really moving in the right direction. So I think that today's discussion has given us some really interesting points to think about. I do hope we can continue that discussion. And obviously we have some upcoming opportunities for that through the launch of the South Asia policy brief, and also future work that we'll be doing on unpaid care work and climate resilient sustainable agriculture, and also the analysis of some of the time diary data that we're going to be producing. So just again, a huge thank you to everyone, and please do stay in touch, stay engaged. Let's keep working together on these issues.
Thanks a lot, Sam, for those words. Just to share also that each person who has been registered on this launch will get it will be sent to you directly, like the link, and you'll be able to access the report. If you have challenges accessing the report, please feel free to contact Jane, and she'll be able to share with you just like a PDF copy of the report. We do have a few printed copies, but obviously because of the distance, we'll not be able to share with many people, but the ones that we are able to come into contact with, we'll be able to share some of the hard copies. And thanks so very much for making the time for this webinar. And we hope that we'll be able to keep connecting and to be able to share more and more lessons. And please go ahead and read the policy brief. We'll be connecting with you in our advocacy work, and we'll use some of your contacts to sort of alert you if there's anything of interest that's happening. And please feel free to be in touch with the Power team and ActionAid in terms of if there's something that you think we could probably collaborate on and we can discuss in terms of unpaid care work and climate resilient sustainable agriculture. So thank you everyone, and have a great day.